My name is Alan Roberts. I'm here with Dr. Alan Chen. What we're about to give is not medical advice. It's just opinion. This is just two dudes about to have a conversation about whatever the fuck comes up to our mind.
So I'm a pediatric radiologist. Basically what that is that I curate medical imaging for children. So anything from CTs, MRIs, x-rays, anything imaging for the most part. And part of what I like to do on my channel is talk about the way the healthcare system is in the West, especially with how broken it is. To be able to get people to kind of unplug from just general what the mainstream media tells you, what mainstream medicine tells you, and think a little differently and be able to open your mind up to really see the world for what it is and just have differing opinions on things that you may not be able to see because it's often suppressed. Lesser goal of mine would be to also warn the other countries that haven't had an obesity epidemic yet that it's coming. I've traveled a lot, so over the years, it's certainly been a growing problem in other countries as well, not just our country. So it's a sort of a warning sign for those out there overseas to keep in mind of what we're doing wrong and not do it yourselves.
I find that really interesting. I was a healthcare executive for a long time. And the reason why I left being a healthcare executive is because I realized we weren't actually trying to help anybody get healthy, in my opinion, of course, right? When did you start seeing the systemic issues with the healthcare system? When did you start noticing?
I think I had an inkling. It was just like kind of the thing in the back of my head that was like sort of bothering me since I was in medical school, but it didn't really come into fruition until 2020, the year of the cough. Where everything started to come together. Now things are starting to make sense a little bit more. You start wrapping into other aspects that are, I thought originally were completely separate from health, like politics, for example. Now they're all like intertwined with each other and colluding with each other to a degree. And that's where I started asking more questions. And the answers, unfortunately, led to even more questions. And then also, and this is kind of let's put our tinfoil hats on. I think this has been in the making. COVID was the match that lit the gas. We were sort of spreading the gas for about maybe 20 years or so. And I would say part of that would be the medical education system. We sort of touched upon that earlier, where the medical education system in general is, here are facts, you memorize facts, take the test, pass the test. Pretty much repetitive over and over and over again for 4 years. And the part of my sort of evolution of thinking was, wait a minute, I was told I need to know these things and almost accept them as fact, because if I didn't accept them as fact, then I failed the test. Pretty much it was just like, you fed it, you vomited it out, and then you move on. So that in turn allowed the doctors to just be ready to feed more information and not really question anything. Secondly, I think the other big thing with doctors is that if you watch the trends of compensation and also a debt. Right now, the average student debt for medical students is somewhere around $250K. And you're probably working with that debt for a long period of time because you're going to accrue it during residency. And then it takes however some years, sometimes people take until 40s or 50s to be able to pay off that debt. If you kind of trap them with the money thing, because it was very difficult for us to go against or question anything because we in the back of our minds, we had our jobs on the line, and our jobs feed our families, our jobs, give us food, shelter, transportation, whatever. And we didn't have another world to live in, really.
I also argue that not only was it set up where if you're a doctor, you're normally X amount of dollars in debt when you get out of med school. And if they pull your license, you're fucked. It was the first time that I really noticed, really noticed that health policy wasn't being actually discussed by doctors that were doing treatments. It was by people that weren't even involved with the treatment. And it was very politicized, right? I mean, anybody that tries to say COVID wasn't politicized was not paying attention, right? It's like, it wasn't 3 years of public health officials making stupid mistakes. Because first of all, if you're in healthcare and you memorize that much stuff about health, you have some sort of IQ to you. You know what I mean?
Absolutely.
And there was just so many basic things that we did completely wrong. Like one of the ones that people don't talk about is when we sent college kids home. It was looking pretty clear that younger, healthier people were at almost no risk. It was obese people and elderly people, just like every other novel respiratory virus. By February of 2020, there was literally articles from Italy and China that you could read that pretty much stated they could be carriers. And if they would get sick, even if they would get symptomatic, it would be very mild. However, they could transmit a novel virus, right? So we took college kids who went from all different areas of the country to a college, crawled all over each other like college kids do. Then they went on spring break, crawled all over other college kids, and then went back to their college, crawled all over each other. And then instead of saying, hey, we've got a novel virus, we're going to shelter these people in place, and nobody moves. We stop air travel, we stop everything like that. We wait 2 weeks and no transmission. But instead, we made all the college kids go home to their middle-aged parents who are fat as fuck and their elderly grandparents who are already immunocompromised. Yeah. And I'm just like, this is a dispersal method. This is the last thing we should do. They should be sheltering these people in place, right? They're already safe. They're at their university. And instead, it just became so clear that things were being done to basically incite fear and incite panic for control.
Right. So medical schools at the time.
Yeah.
So third and fourth year is typically our clinical year. So we see as many patients as we can. We rotate different wards and see different specialties. So they actually sent the third and fourth year medical students home. They didn't actually have them go into the wards. A lot of places
I did not know that.
And what's crazier is that's a pandemic is like a great time for a medical student to learn. It's like, because it's something that doesn't really happen a whole lot, right? So that's why it was crazy to me. I was like, wait, huh? Like, why are you sending them home? Like, this is a great place to learn how public health works, learn how emergency situations happen, because God forbid if something happens in your facility where you work, sometimes there's outbreaks of norovirus or something like that, where you have to be able to think on the fly and not treat the patients properly in large mass scales. So I was just dumbfounded. I was like, why would you do that?